Here are some more examples of the foreground and background questions to make it more understandable, more clear. In patients with severe aortic stenosis without symptoms, which prognostic indicators are helpful in determining the timing of aortic valve replacement? So, what would you say is this? Is it a foreground or background question? If it would be a foreground question, you would expect 4 components. The problem or patients. Do we have this? Yes. These are patients with severe aortic stenosis without symptoms. Then, what are we comparing? Are we comparing something? Actually not. There is no comparison or intervention groups. But we have an outcome, namely timing of aortic valve replacement. So this is more a question of background type, because we don't have these 4 components of the foreground question. We have asked here which prognostic indicators. Okay. The next question: in patients with acquired brain injury, do the non-pharmacological interventions cited in the literature, like these ones, compared to one another, prove superior at decreasing intracranial pressure and improving survival? Just look at the question once more and try to tell yourself what are the different components. What is our first P? Acquired, patients with acquired brain injury. Okay, this is our P. What is the intervention and comparison? We are comparing all these in the bracket, within this bracket, to one another. So intervention and comparison are all these one by one. Each of them you may call an intervention or a comparison. Hyperbaric oxygen, hypothermia, CSF drainage, etc. Then the outcome, the O. What is our O here? We have decreasing intracranial pressure. This is our outcome 1. And actually we have another outcome, namely improving survival. Survival is our outcome 2. So we have 2 outcomes. You may have more than one intervention, more than one comparison, as well as more than one outcome in clinical questions. The next one: in women with history of atopic dermatitis who breastfed their babies compared to those who formula feed, is there a lower risk of developing atopic dermatitis in their newborns? So this time it will be very easy for you, I'm sure, to define the 4 components. P is what? Woman with history of atopic dermatitis. This is our patient's problem. Then we need 2 groups at least to compare: who breastfeed and formula feed. Okay, so intervention and comparison. And what is our outcome? Developing atopic dermatitis, risk of developing, so the prevalence of atopic dermatitis. Prevalence, this is our outcome. This you can measure. What proportion of these babies had atopic dermatitis? Very easy to measure. Okay. As the sentence is smaller, you should guess that is a background question, of course, but it doesn't function always, but most of the time. Does adolescent BMI have a correlation with adult coronary artery disease or atherosclerosis? Do we have the 4 components here? No, we don't have. Instead, we are asking what is the correlation, or is there a correlation between BMI and coronary artery disease, atherosclerosis? Next question: In patients with fibromyalgia, does treatment with opioids compared to treatment with non-opioid analgesics or placebo result in reduction of chronic pain? Is it a foreground or background question, first of all? Of course, it is a foreground question. Yes, thank you. Then the P, patients with fibromyalgia, problem or patients. Opioid treatment with opioids, intervention, compared with non-opioid analgesics, so other analgesics, so comparison, and the outcome is pain. In children with acute abdominal pain, is transabdominal ultrasound compared to computed tomography imaging more sensitive and specific for diagnosing acute appendicitis? I will leave this without marking the components. Do it yourself. Give yourself time. Stop the video. I'm sure you will be able to answer it. If not, write to the forums. Next one. In adults with heart failure and reduced systolic function, would adding the implantation of an electronic resynchronization device to standard therapy reduce morbidity or mortality enough over 3 to 5 years to be worth the potential additional harmful effects and costs? Okay, this is more complicated because it has more components, more than one outcome, for example. What would be the outcome here? Yes, I allow you to think briefly. What would be the outcome? Do we have one or more outcomes? Harmful effects, yes, this is one outcome. And costs, this is another outcome. So outcome 1 and outcome 2. Outcome 1 and outcome 2. Okay. The other components I will not mark. And I have 2 more examples. Are mass media interventions effective in preventing smoking in young people? Problem, young people. You have to define the problem. Then intervention. What do we mean by mass media? It can be so many different things. Then comparison group, no intervention, and outcome. Effect in preventing smoking in young people. If you want to extend the PICO to PICO-T, then what kind of studies you could do to analyze this, to answer this question? You could do preferably an RCT, because what? Because the RCT was in the evidence pyramid above somewhere. Okay, good. Last slide here. Let's go back to the vignette, to the case vignette, the patient with the heart murmur. Eisenmenger, which had Eisenmenger. What did you ask? Was it a foreground or background question? Probably, if you are a student, it's very normal that you ask background questions. If you ask a background question, please try to formulate the components of your background question, because background questions must have 2 components. If you probably you asked the background question, then try to formulate your question, try to convert your question into a foreground question. Okay, and let us discuss all this in our forums. Good. Another break. Stop recording.